Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Kim Downey, Tamara Beckford, and Robert Kornfeld. Kim is a physical therapist. Tamara is an emergency physician. Robert is a podiatrist. And today, we're going to talk about the KevinMD article, Doctors Rediscover Joy in Practicing Medicine on Their Own Terms. Kim, Tamara, and Robert, welcome to the show.
Thank you.
Kim, I'm going to start with you. You are a renowned physician advocate. I see you on LinkedIn, and thank you for bringing everyone together as you always do. So let me start by asking you, how did you find Tamara and Robert?
Sure. So that would be LinkedIn. And I looked back and I saw Tamara. She was one of the first connections I made on LinkedIn. And when I reached out to make the connection, she actually got back to me and was curious about how I found her. She actually said, "How did you find me? What made you interested in connecting with me?" And then so we went back and forth a little, and I told her, why, and we continued on. And then at one point, I asked her if we could Zoom because again, I thought she could have some information that might help me help my other doctors. And she graciously agreed to do that. And we did. And we've just communicated back and forth since then. And Robert, I would have reached out to make a connection with him on LinkedIn. And then we ended up, as I was making more connections and they were all making more connections, kind of ended up in a little cohort. And where they, there's a group of physicians that support each other's posts. And I was kind of in that little group, even though I'm not a physician, and I, just try to support them and their work and their posts.
All right. So the theme of today's conversation is rediscovering your joy in practicing medicine on your own terms. So Tamara, just briefly share your story and journey today.
Absolutely. So thank you again, Kevin, for having me on here. So as you mentioned, I'm an emergency medicine physician. And prior to the pandemic, I think I realized now that we're learning about burnout, that I was getting to the point of burnout. So I started to invest in a lot of personal growth, reading all the personal growth books and watching, the podcast, listening and watching podcasts. Then the pandemic hit. And, during that time, I already started working on a morning routine and working on just self. The pandemic hit hard, and then I started to notice that a lot of my colleagues around me, they were really suffering during the pandemic. As an emergency medicine physician, you can imagine how it is, a lot of anxiety. We don't know what this virus is. How's it going to affect you? And are you going to take it home to your family? As I continued to thrive during that time, I realized that this is something I should probably share my technique with others, which is, one of my drive for one of the many things that I do. And I'll say that one of the ways that I thrived was through community and, through the physician community, realizing that there are other physicians who had the mindset of entrepreneurship like I did. I'm part of, for those who are listening, EntreMD, EBS, I'm part of that. I get to help my other physician colleagues through that. And I also get to help physicians who have private practices. I help them to really get their private practice to thrive by bringing their team together, having them cast the vision of the private practice owners onto their team, and to really help them with their profitability and proficiency. So all of that has made me realize that it's not only about me, it's what I can do for my community around me. And that is helping me to thrive. I find a lot of joy in what I do. And it all started with self, because I worked on myself before this whole started. And then now working on self had brought me the compassion and the energy to help all my other physician colleagues. So that's my story.
So Tamara, let me ask you, so during the pandemic, you mentioned that you felt burnt out like a lot of emergency medicine physicians, but there's a difference in your story that you took action and created these entrepreneurial ventures, whereas so many physicians I talk to, they feel stuck and not sure what to do. So what separates you? What made you take action when so many of your peers and colleagues felt stuck?
One of the things that really separated me, I think, is the fact that I started working on myself before the pandemic started. So once the pandemic came in, I was already in full gear of realizing what the landscape looked like, recognizing the signs of burnout, recognizing what I needed to do to keep myself level-headed, to bring joy within myself. So I saw that, I knew what it looked like. And so around me, when I saw others turning downward, I had already gone through that period. So I already had the inner strength. And it's not to say that my colleagues were weak, because we all have ended up building ourselves up as a result. But I just started a little earlier than my colleagues. And that's the difference.
Robert, you're a podiatrist. Please
Yes, I
share
am.
your story and journey to where you are today.
So when I completed my training, I went into practice. And of course, as you can see, I'm not a young doctor. It was well before managed care, well before all of the CPT codes and ICD codes. I opened an office. I put an ad in a local penny saver. I explained what I did, and the practice began to take off really quickly. And I was on staff at a couple of area hospitals. I was doing lots of surgery. I was seeing lots of patients. And within about 2.5 years, I was up to 50, 60 patients a day.
Wow.
I was going home for dinner at 10:30 at night. And unbeknownst to me, things started to shift in my personality and in the way that I was seeing things. When I got to the office, if I saw a really busy schedule, I felt stress and anxiety. And within maybe 2 years, I had all the signs and symptoms of what we now call burnout. I was depressed, I was anxious, I was fatigued, I couldn't think straight, I didn't want to go out, I had no time for anything. And didn't really know what to do about it because I was kind of feeling ashamed of what was happening to me. So I, little by little, tried to pull myself out of it, but I still had to go to work and work like a dog. Then I decided this isn't something I can handle. I'll deal with it on my own terms, and I went for help. And it became very clear to me that I was kind of working against my innate nature. I had always been a very conscious human being. I was into meditation and yoga. I was a macrobiotic vegan. I liked to be out in nature in the woods. And here I was in a world of drugs and surgery and, black and white. And when I finally realized that that was happening, I said, how can I bring my lifestyle into my practice? So I began investigating what they then called holistic medicine, alternative medicine. Probably by 1987, I started finding organizations that were teaching things, and I was going to seminars and I was training myself. I started to bring it into my practice, and I started to feel really happy. Unfortunately, what I soon found out is that insurance companies weren't happy to pay for anything that I was doing that was natural.
Mm-hmm.
So I had to separate my practice into two parts: the typical conventional medicine and the holistic. The holistic patients paid me, and the others I would accept insurance. Then managed care came along. And I thought, oh, what a great idea. I don't have to market myself. I don't have to kill myself. And I started to go through that. I think I joined up in around 92 or 93, probably 92. In 1999, I got a notice from Blue Cross Blue Shield that they wanted 40 of my charts. I sent them. And before long, they asked for a refund of $87,000. And I said, for what? And they said, well, we don't cover what you do. I said, I didn't charge you for that. I only charged you for the evaluation and management of these patients. I did not charge you for any of the holistic therapies and regenerative medicine. So they said, well, that's part of it, and we don't want to pay for it. I said, well, I have a chronic pain practice. Did you want me to do the same thing that already failed 7 times on these people? What I did worked. So long story short, of the 40 patients, 38 agreed to come and support me in court. And I told them, and then they backed off and disappeared. And at that point, I said, I really have to do something different.
Mm-hmm.
And that was when I said, I'm not going to deal with insurance on any level. By the year 2000, I was out of all my contracts. I was completely direct pay. And I started to notice an amazing shift in me, in how I felt. I had so much more time for my patients because they were paying me. It wasn't an $8.40 visit. I was giving all of myself. The doctor-patient relationships got deeper and more potent. And I decided this is something I should teach to my colleagues. So I put together a teaching institute. It was a dismal failure. No one wanted to come and learn. And before long, I was marginalized by my entire profession, and I just gave up. Fast forward to about a year ago, maybe a little more than a year ago, all of a sudden I'm getting tons of emails from podiatrists who had read articles that I've written, saw my podcasts, saw me on TV interviews, listened to my radio show, which I had for a number of years, and were asking me to help. So that meant that this boomer had to learn technology and social media. And I built a course, I founded an institute, and it's now about 9 months into it. It's not blockbuster. I have a little over 20 podiatrists that are taking the course and learning and being mentored by me. But I've never been happier in my life, because really and truly, what do we want in life? To take care of our patients, to go to work and feel that we've made a difference. And after all the training that we've gone through, we deserve to make a good living. We don't deserve to be exploited and abused by insurance companies. And that's what I hope to put forth to, all of the podiatrists out there that are miserable and struggling and going through burnout and still trying to push through it.
Now, Robert, let me ask you a couple of questions. Number one, how common is that direct pay podiatry phenomenon? How common is it to find a direct pay podiatrist today? And my second question is, how difficult is it for most podiatrists to make that transition from insurance-based care to direct pay? I talk to a lot of doctors, and that transition, sometimes they're a little bit apprehensive about that. So talk more about that.
Well, I think there's very few podiatrists in the country doing a direct pay approach. Maybe you'll find 10 or 12 of us. Now that I have all of these students that are learning, you'll probably find 20 more pretty soon. But no, not a lot. I think a lot of people are so conditioned to think that their patients won't pay them because their services have been devalued by insurance companies. So therefore, they have devalued their own offerings. On the other side of the coin, I don't think any change is easy. You have to be willing to do the work. And those that are looking for an easy fix are not going to find it. If you don't take the time to create a platform that can be communicated effectively to the public and know what you're talking about, it's going to be really difficult. And a lot of people are going to put their tail between their legs and go back to what they were doing before. But like I do, like Tamara does, when you have a mentor who's already been there and done that and come out of it, we can take people from 0 to 60 a lot faster than they can trying to muddle through it all by themselves.
Kim, what specifically about Tamara and Robert's stories resonated with you? And I know you talked to a lot of previously burned out doctors on LinkedIn. You connect with so many, but specifically with Tamara's and Robert's story, what parts resonated with you?
Well, when I just presented the idea to you of a group of articles with physicians doing different things, and I wanted to help other doctors, and I wanted to spotlight different physicians, men and women, and different specialties doing all kinds of different things, having gone through burnout and are now thriving. And, a few doctors, I wanted to approach it from like an individual standpoint. How did they help themselves? And then another group of doctors, went on to receive coaching and support other doctors. And then I was looking for, doctors who are not only still practicing medicine, but doing other things also. And I immediately thought of Robert and, Tamara, because that's exactly what they're doing. And then, of course, we're going to do this again and spotlight some physicians who have pivoted from medicine. So since what I want to do is show doctors that there's so many different things you can do to help yourself, and you can find joy, in your own work and in doing other things. So it was just that I saw that what they had built and that they were successful and that they were happy. And I wanted to spotlight them so other doctors could see that.
Tamara, let me ask, a lot of physicians I talk to, they have a lot of entrepreneurial ideas, but just don't know how to take that next step because they don't have an MBA, they don't have any business training. The only thing that they know how to do is clinical medicine. Now, for those physicians who have a kernel of an entrepreneurial idea, but don't necessarily have that business background, what kind of advice can you share with them to take that next step and perhaps explore that entrepreneurial idea?
Absolutely. I love that question because it covers so much of what's going on in the mind of most physicians. So, one is if you do have a kernel of an idea, the biggest and the hardest portion, even Robert talked about it, is just to start. Because the momentum, once you start, it keeps going. And there are a lot of other entrepreneurs out there that will help you along the way. So do find a mentor, find a school. If there are schools, find a business coach. Fortunately, I am a part of the EntreMD Business School. And there I also mentor physicians with a success group every week. So if you are part of the school, or if you did become, then you'll see me where we'll help you to get through your ideas, and then you'll get the support. The other thing is to get out of your mind that medicine is the only thing you know how to do. You are filled with a lot of skills, and these skills, they're transferable to other industries, and they are waiting to hear from physicians because the way we think, it's different. The way that we analyze things are different, and it's great to be able to get people who think and analyze like us in other industries. So do not belittle your mind into thinking the only thing I know how to do is medicine, because you have dedicated so many years to honing in this craft. In that time, you have learned a lot of other marketable skills. So do not belittle yourself. Write down a list of the things that you like to do, things that brings you joy, things that you would love to do, things that you did prior to entering into medical school. And then you can use some of those skills to be able to enter into your entrepreneurship journey. I've seen many people do it. We have physicians who are artists, right? We have physicians who not just are doing that, but they have coaching. You have physicians who are coaching in many things, in running, in exercise, health and wellness, stress management. There are also physicians who love beauty, and they're coming up with inventions. We have a lovely physician, I think she was not too long on here, who has invented the postpartum ice panties. There's so many ideas. You have it all within you. So do not think that the only thing I can do is medicine. And I think Robert touched upon that too. We have a lot of skills that are marketable. So step one is finding out what you like to do in addition to medicine. Step two, finding a mentor. And step three, do it.
Let me follow up, Tamara. I talked to some physicians, maybe more what we call conventional physicians, who push back against that notion and say physicians who do things outside of the hospital or do things other than see patients are maybe considered, quote unquote, less of a physician. And they believe that physicians should only see patients because they've invested so much time into education. What's your response to that type of pushback?
I would say that's nonsense. I'm just going to put it out there. That is nonsense. If you look at the physicians who are thriving emotionally, they're the physicians who are able to balance. And that's one of the things, and you're asking even me, that's what gives me a lot of balance. I am seeing the hard clinical patients during the week. I'm still an emergency medicine physician. I still work clinically. And then I get to balance that with the creativity of coming up with ways to help people manage their stress, manage their burnout. I have never been happier in my life than these last few years where I invested in both parts. So if we want longevity in medicine, we have to be able to allow those both parts of our physicians to thrive. Because if we remember that physicians are not robots, we cannot just do the same thing over and over, and especially as Robert talked about, and deal with the never-ending oppression, the never-ending oppression of your ideas, thinking that you're just here just to quote unquote serve the clients who are no longer patients anymore, because now they're just, we're clients. And how is it that one expects a physician who has put in the work to emotionally give and to just consistently give, because the receiving portion has diminished a lot. So how do we receive and how do we give back to ourselves is by that balance. So no, we are not just physicians here to give to institutions and to insurance companies and to be marginalized. No, we have the power within. And once you recognize you do have that power to live life on your own terms, that's when the happiness and the joy comes out. And that's when you have the longevity in medicine that's needed.
We're talking to Kim Downey, Tamara Beckford, and Robert Kornfeld. Kim is a physical therapist. Tamara is an emergency physician. Robert is a podiatrist. We're discussing a KevinMD article, Doctors Rediscover Joy in Practicing Medicine on Their Own Terms. I'm going to ask each of you just to share some take-home messages to the KevinMD audience. Robert, why don't we start with you?
So I would say the first thing that doctors who are unhappy with what they're currently experiencing need to do is acknowledge the fact that change can be scary, but not to let that fear stop them from moving forward. Use that fear, push through that fear. As Winston Churchill once said, if you find yourself walking through hell, keep going, right? Don't stay there. Empowerment comes from successfully overcoming challenges. If you buckle to them, you spend an entire lifetime feeling beaten down and unhappy. Nobody deserves that. I mean, I can tell you honestly, from my own perspective, I'm 69 years old. I'm still going strong. I'm empowered every day. I love going to work. I love helping my students, but I also have time to pursue my own passions, which is another part of what direct care offers. You have time. So I'm a songwriter, I'm a musician, I'm in a band, we play live shows. I am full of joy because I've allowed that to come into my life. So I guess my takeaway would be allow for change, even though you're afraid.
Tamara, please share some take-home messages.
So I'll take the take-home message that I'd like to share with. It's just like what Nike said, just do it. If you have the inkling of entrepreneurship, if you have the inkling that you'd like to do something different, there are other people out there who are willing to support you. I know as physicians or as doctors, a lot of times we feel like as if we're in silos, but remember, you're not. Reach out to the community, reach out and find someone who will support you to get you through that uncomfortable change, as Robert just mentioned, that is change, the uncomfortableness that comes along with change. So do not sit by yourself. Do not sit and be depressed. Do not sit and be discouraged. Remember, there are others out there who are willing to help you. So take that first initiative and just do it.
And Kim, we'll end with you. Please share some take-home messages.
Sure. And Dr. Amna Shabir had also contributed to this article, and we weren't all able to be here together today. So I wanted to start with sharing some of Amna's voice and also to thank her. She's doing an incredible job supporting early career physicians through her Early Career Physicians Institute. So thank you, Amna, for all your work with that. And she talks in the article about how important it is to find a community of like-minded physicians who are all advocating for physician wellness. And all of you have spoken today of the importance of community. And she had shared that when we are in the awful space of burnout, overwhelm, and moral injury, everything appears unattainable. Even asking for help is exhausting. And she shares that from personal experience. She knows what it feels like. And she says that know that things can change and life truly can get better. One must simply take the first step and ask for help. Yes, it can be that simple. I would urge you to take that first step and not wait any longer. And her takeaway is that I urge early career physicians to take their well-being seriously and spend time actively working on it. This is how they will have true longevity in life and in their careers. So in this podcast today and in the article, we did talk a little about feeling stuck. And so I just wanted to expand on some of the things that Amna shared in the article, her message. And I just wanted to say that all people, including doctors, need to feel connected to other people. Everyone needs to have people they can feel safe talking to about hard things. And some doctors aren't sure about who is safe for them to open up to for a variety of reasons. And there are so many doctors out there who understand that feeling and have felt similarly. And if that describes you, me or any of the dozen physicians I've collaborated on with this group of articles, and you could search my name in Kevin's search bar if you wanted to find the other physicians, would be happy to speak with you confidentially and steer you in the right direction. And I've also shared a couple times on this site and on LinkedIn a list of free and confidential resources for physicians. And some doctors feel that only another doctor would understand, and there are many physicians who have been there and wish to support their peers, including everyone on the screen and the other doctors that I've mentioned. And some doctors don't feel comfortable opening up to another physician. And in those situations, there are other professionals, for example, on the Physicians Anonymous site, who you could reach out to. And I've had conversations with some of them, and I know them to be trustworthy, smart, kind, supportive, and with great listening skills. So basically, if you're feeling stuck, the help is out there, and any of us can and would help you find it.
Well, thank you all for sharing your stories, time, and insight. Thanks all for coming on the show.
Thank
Thank
you.
you for having us.
Kevin.